It is the diagnosis no one wants to hear. Your loved one has Alzheimer's.
That alone is painful enough, but 1 in 7 nursing home patients, according to a government study, also end up sedated by powerful drugs, cutting them off from the world and their families. Now a new pilot program is awakening these patients and helping them reconnect with life. Carol Evans-Boyd Hubert shows us how as he travels the land of 10,000 stories.
Long stilled, Alzheimer's patient Melvin Babcock is on the move again after being slowly weaned from anti-psychotics.
He was just too tired to stay awake.
His son Gary keeps a notepad of his father's words, the first he's heard him speak in 2 years.
And he said, "That was our son Gary that just left." And I heard that as I was leaving the room, and I couldn't believe it.
Melvin was a mechanic who used to drive school buses.
What do you think of that one, Melvin?
Something his aides kept in mind as they looked for substitutes for the drugs prescribed to keep Melvin calm.
It's really easy to pick up the phone and say, "Doctor, so-and-so's calling out, could we have a medication?" Versus, "You know, Mary, let's talk about what you did when
Ecumen is just 1 year into a 3-year project, so no hard data yet. But early signs are positive. Experts say programs like Awakenings will not eliminate the need for antipsychotics, but the goal is to greatly reduce their use in nursing homes. It's important to point out none of these things reverse the effects of Alzheimer's. This is about the quality of life after diagnosis.
Certainly interesting, to say the least. You said it's funded by a $3.5 million grant. So what happens then when the money runs out?
Right. The grant mostly pays for extra staffing now at that home in North Branch. That's 3 part-time people. Ecumen is saying, yes, we know it's more expensive, but we'll worry about that part later. This is a study now. They're seeing that some of these things work and going ahead in that direction. The funding issues will have to be taken care of later.
I know a lot of people are going to see that who have loved ones who they would really love to have getting that kind of care. I'm assuming the study is full, or is this something people can still sign up for?
At this particular facility and the Ecumen facilities, there are people coming in and going out all the time. Some people actually graduate. The drugs have been taken away. They're doing great, so they can bring another person in. Of course, some people pass away, but there are about 15 to 17 people in the program all the time at the North Branch facility. But those people are always changing, being switched out.
Oh, fascinating.
What a feeling, though, to walk out and have your dad say, "That was my son."
It's touching.
After
Thank
2
you,
years.
Boyd.
Right.
Thanks, Boyd. Let's
Here's Carolyn Jarvis.
With the number of seniors in Canada expected to reach an all-time high within a generation, so too will the number of people with dementia. It is a frightening, confusing descent into the unknown. Most will end their lives in nursing homes, many treated with powerful antipsychotic medication. These drugs are used to subdue dementia patients who can be agitated and difficult to manage. But numerous studies show antipsychotics can also have dangerous side effects, including death. In Canada, 1/3 of all nursing home residents are prescribed these drugs, but nowhere are they more prevalent than in British Columbia, where fully half of all nursing home residents are on antipsychotics. Tonight, 16 by 9 explores why the frail and the vulnerable are increasingly under the influence of chemical restraints.
Sing a song with me today?
400 kilometers south of the Canadian border, there is a sea change underway.
You are my sunshine.
Here in North Branch, Minnesota, the entire staff at the Ecumen Seniors Home has been retrained, the approach to treating residents with dementia redesigned, and the results have been remarkable.
It's been a godsend.
Jean Lynch and Gary Babcock each watched their parents, Hazel and Melvin, transform through a pilot project called Awakenings. What they were awoken from was a chemically induced fog after being prescribed antipsychotic drugs.
What was your father like when he was on these drugs?
He would be in the wheelchair, and his head would be dropping off to one side, and like this. We thought that he didn't probably have much time left to live.
As part of the program, Hazel and Melvin's dosage of antipsychotics was gradually reduced until it was eliminated altogether. Stephanie Johnson is the lead nurse for the pilot project in North Branch.
The dementia will still be there. We're just looking to reduce the medications and work with the residents, get them to the highest level of functioning possible and quality of life. What those behaviors are telling us something. So is it a matter of somebody's hungry or thirsty? Is it a matter, is somebody in pain? Are we missing that on somebody who can't verbalize that to us?
It was only a matter of weeks before a switch turned on inside Hazel and Melvin. Virtually immobile on the drugs, soon both were moving.
Where are we going?
I don't know.
Where are you going, Melvin?
You can't go in the kitchen.
Hold it.
Okay.
Is that meat good?
Yes, meat is good. Do you want a little piece of meat?
Melvin can now feed himself.
It's good.
And Hazel is no longer lashing out at staff.
You said earlier that you thought your father's days were numbered when he was on those pills.
Absolutely.
Today, what do you think?
Well, you know, he's 91 years old, going on 92, and I'm sure they are numbered. But it's giving him such a wonderful, I think, opportunity to do things at the end of his life instead of being just shut up in a dark closet, so to speak.
Yeah, you're going to go to...
Early indications after the first year of the project are so promising. Ecumen's vice president says this could be the model for care across the country.